Lurie Children's Hospital is a special place. The people of Illinois helped build the hospital, and many workers of Illinois helped put it together. And now, after 9 months, the hospital is going stronger than ever. And we wanted to come here to this place on this day because our job is to end the silence about the violence. It is so important that all of us in Illinois, 13 million people strong, a family of Illinois, come together at this crucial time and band together, not for profit, for a cause we believe in. And that is taking on the violence that is perpetrated too often in our society, particularly against children. Last week, the tragic situation where Joni Law Watkins lost her life at the age of 6 months while her diaper was being changed should be an alarm bell to all of us that we need to do more and more to end the violence. And as was just mentioned, violence is a public health menace, and we have to use public health strategies to take on and prevent violence. And the hospital and many of the partners that are involved in the Strengthening Chicago's Youth program, a public health model, I think provide a good example to all of us what can be done when we band together. Public health is all about preventing bad things from happening in the first place. That's what we have to perceive and look at when we see violence. We have to prevent it from happening in the first place. And I happen to live on the west side of Chicago, almost straight west from here, and I was at 2 churches yesterday on the west side, and we spoke about the imperative that all of us are in this together. We have to find ways that everyone can be a volunteer in this mission of preventing violence. And we have today with us our Director of Public Health, Dr. Lamar Hasbrook, who's going to talk in just 1 minute about the strategies that will be employed as part of our mission. This is a mission, and it bubbles up from the grassroots, not from the top down. We all have to play a role in early childhood education, in mentoring our kids, in after-school programs that prevent kids from going in the wrong direction, in making sure we have jobs, particularly summer jobs for young people, so they have something positive to focus on, and making sure we have gun safety. Yesterday, not far from here, I was at a gathering of people who want to make sure that we do something about the plague of gun violence and emphasizing the importance of gun safety, common sense laws that will protect us from harm. So all of this comes together as a strategy, a public health strategy to protect the people and the health of the people.
So hear me very clearly. More than heart disease, strokes, diabetes, birth defects, influenza, and pneumonia combined, homicide is the second leading cause of death for young people. And among young black people, it is the #1 leading cause of death. Over the past 3 years, nearly 1,000 young people here in our state have been murdered. And as the map shows, most of this is occurring in the city and the surrounding Cook County. And sadly, this is just the tip of the iceberg, because for every 1 child that's killed, there's hundreds of children that face non-fatal injuries causing them to present to the emergency departments. And then there's tens of thousands of victims of lesser forms of violence for every 1 homicide. So from cyberbullying to physical fights, gang activity to rampage shootings, the violence depicted on television, in music, in video games, and that of our larger society is spilling over and threatening the longevity of our children, their safety, their health, and in fact, their futures. The recent tragedies are a clear but sad reminder of this. So what do? I would suggest to you that we view the problem of youth violence through a much broader lens, not simply through the eyes of the grieving families and the hurting communities, although our prayers certainly go out to them, and not solely through the justice system perspective with punitive measures, after-the-fact reactions with the limited deterrent effects, or the mental health approaches aimed at treating the troubled individuals, but also from a public health perspective that seeks to prevent violence before it happens and complements the other approaches. And while no one strategy will stop every violent act, We will never be able to predict with any certainty the next school shooting or profile every single future perpetrator. There is a lot that we do know based on nearly 30 years of research. For instance, we understand the risk factors and how we can decrease them. We understand well the protective factors and how we can increase and buffer youth around those. This week is National Youth Violence Prevention Week, and during this entire week, we want to increase awareness that youth violence can and should be prevented. We want to shine the spotlight on proactive prevention strategies and programs based on best available evidence that can make a real difference. We want to put the tools in the hands of all of our 96 local health departments, schools, communities, and health providers, and others. So we're encouraging folks to visit our IDPH website for a list of resources, tools, and guidance. The bottom line here is that violence is preventable and not inevitable. I'm honored to be a part of an administration and stand here shoulder to shoulder with these champions behind me who actually believe this. By working together, working smarter, and refusing to tire, we can and will transform the circumstances for our youth. Thank you.
As a pediatric emergency medicine physician, I see the impact of violence far too frequently. I can help patch up physical wounds, but I can't do much to fix the underlying causes of these violent injuries, the influences children experience every day in their homes, schools, and communities. But I also provide primary care to children enrolled in the Chicago Youth Programs, a youth development organization that I helped co-found over 30 years ago. Our children come from the city's poorest and most violent neighborhoods, but with the support of volunteer mentors and the hard work of the children and their families, I've seen my former patients go on to college to become teachers, nurses, and community mental health workers. As helpful as this individual action can be, changes to systems can make even more of a difference. Violence is very complicated, perhaps more complicated than some of the rare conditions we treat here. And preventing violence requires many different partners working in synergy using many different strategies. This is why Lurie Children's has convened a violence prevention collaborative called Strengthening Chicago's Youth, or SCI. SCI facilitates collaboration among hundreds of service providers, researchers, policymakers, and other stakeholders around a public health approach to violence prevention. In the past, we've collaborated with the White House and others to improve how data can be used in violence prevention. We are working with Columbia College to connect reporters and community-based organizations, and we have testified on behalf of common sense gun violence prevention legislation at the county, state, and federal levels. In recognition of National Youth Violence Prevention Week, I would like to share 5 suggestions from the SCI policy agenda on how policymakers and each of us as individuals can help prevent youth violence. First, we need sustained investment in children and our youth. At every level of government, a commitment needs to be made to fund programs and implement laws that will enable our young people to reach their full potential. As individuals, we can also make a commitment to youth. As a pediatrician and the mother of an adolescent, I can tell you just when our teens push us away may be the time they need us most. So establish a regular time to check in with your kids. Consider becoming a mentor to a young person. Second, every community needs equitable access to high-quality mental health services. Our lawmakers can ensure that resources are dedicated to allow every Illinois resident to get the care they need. As individuals, we can look out for our family, friends, and neighbors and encourage them to seek help when we see signs of trouble. Third, we need to adopt common sense approaches to gun violence prevention. The presence of firearms does not cause violence, but it does make the violence far more lethal. Our law should require universal background checks, that firearms be titled just like cars, and hold gun dealers accountable for their actions. Fourth, our juvenile justice system should reflect what we know about adolescent development. As a pediatrician, I know that children's physical and cognitive development, their medical needs, and their understanding of what is happening is far different than that of adults. Our juvenile justice policy should recognize that adolescent brains are not fully developed and view a child's involvement with the justice system for an opportunity for positive intervention. As individuals, we can model good behavior and teach children how to resolve conflict appropriately. And lastly, we need sustained investment in strong communities. Policies related to economic development, employment, housing, and even transportation can help address the fact that the toll of violence falls disproportionately on low-income minority communities. As individuals, we can be part of strengthening our own communities by getting involved, join a block club, or volunteer at your local school. National Youth Violence Prevention Week is a good opportunity to start taking action. We all have a part to play in strengthening Chicago's youth and the youth of Illinois. Thank you.